Learn Chiropractic, Part 3, Spinal Evaluation, Static Palpation. Static palpation involves feeling the spine for any unusual signs such as tender spots, fixated vertebrae, muscle contraction imbalances, heat, and even skin texture. Such abnormal findings are usually associated with a vertebra that requires adjusting, which makes static palpation another helpful diagnostic tool. Using the tips of your index finger and thumb, contact the facet joints of each cervical vertebra and gently push downwards. You should feel movement of each joint as it gives to the pressure. Be conscious of your force. It should not be uncomfortable to the patient. Note any levels that feel rigid. Ask the patient to report any excessively tender spots and take note. Next, using your thumbs as shown, gently but firmly push the sides of each spinous process to its end range of motion, alternating sides. For each level, feel if one side is more restricted than the other, and take note. Repeat the process for the thoracic vertebrae, T1 to T12. Since the thoracic vertebrae are stabilized by ribs, they are naturally less movable than cervical and lumbar vertebrae, but you still should feel some give as you palpate. Next, run the tip of your index finger along both sides of the spine, pushing down firmly. As you do it, look for reactive hyperemia, a small area of exaggerated flushing of skin. This could be a sign of a subluxation at that level. The degree of springiness of individual lumbar vertebrae is somewhere between thoracic and cervical vertebrae. Feel for segments that are rigid compared to the one above or below. Because of their nearly vertical facet joint surfaces, lumbar vertebrae do not rotate as much as cervical or thoracic vertebrae, but if you are attentive, you can still detect those smaller rotational fixations. In order to use static palpation effectively, you must have a solid understanding of the way individual cervical, thoracic, and lumbar vertebrae feel underneath the skin and muscle, and to what degree they should